So thank you, Crystal, for being here.
Thank you. Thank you so much for having me. I'm really, really excited to get to talk to you all today about music therapy and the science behind music therapy. I will say it's a pleasure to be out here. I see some familiar faces in the audience, so I will say as a disclaimer, if you're a music therapist, you're not allowed to answer any questions because you obviously know all the answers. But it is a pleasure to get to speak with you all and to see so many different age ranges and interests in music therapy. So we're going to talk a little bit tonight about what music therapy is and how the science behind music therapy, how music is processed in your brain and how you actually perceive music and how that can help with your health and well-being. So tonight, since I only get to speak with you for about an hour and 15 minutes, we're just kind of scratching the surface as to what music therapy is. So there's so much more to learn about music therapy than what I can share with you this evening. So I will be giving you some resources that if you want to do more in-depth reading regarding music therapy here at the library, I have some resources, websites that you can go to, and then other key terms that you can search so that you can read more about music therapy. Tonight we're really going to focus on music therapy and healthcare. So that's only one part of music therapy. Music therapists work in lots of different areas here in St. Louis. So I work at a healthcare institution. I actually work for St. Louis University Hospital. So individuals that are in the hospital, I use music therapy to help them. But there's also music therapists here in St. Louis that work for special school district for children diagnosed with autism and intellectual disabilities. There's music therapists that work in private practice in wellness and stress management. And I'm actually going to talk a little bit about that with you this evening and some helpful hints as what you can do to take home with you. So you can do some music therapy for yourself at your own home and during your leisure time. And there's also music therapists that work in psychiatric centers with behavioral health issues, for individuals in assisted living facilities and extended care facilities, especially for individuals diagnosed with dementia and Alzheimer's. So you're just getting a small piece about what music therapy is. And I really hope that this piques your interest so that you'll want to go out and do some more learning on your own regarding music therapy. And since we are talking about music therapy, obviously, you'll see I have my guitar here. We'll do a little bit of music as well for you all to enjoy. It wouldn't be a music therapy presentation if we didn't do a little bit of music. So we'll do that. We'll work that in as well. So it's not just going to be all talking this evening. I'm going to see if I can get this to work. Probably have to be a lot closer to this. There it goes. So individuals think that music therapy is a newer profession, but it's actually an older profession here in the United States than people realize. Music therapy, even though it's practiced throughout the entire world, it did formally start here in the United States of America, and it started right after the end of World War II. In veterans hospitals, in VA hospitals. They actually found that soldiers coming back from World War II, they would have amateur and professional musicians perform for those individuals while they were in the hospital. And they found that the music had a very soothing and calming effect on individuals coming back from World War II, especially individuals that were diagnosed with post-traumatic stress disorder, who were having issues with trauma from World War II. Now, the musicians at that time, they didn't have a lot of training in healthcare. So they weren't nurses, they weren't physicians, they were simply musicians who would come into the hospital and perform for the patients. And that was the beginning of music therapy, but it looks very different than what you would see music therapy in the hospital now. So the musicians usually would stand in the hallway or in the doorway of the patient's room or a ward of patients and simply play music for them. And they would play any kind of music that they wanted to and for any length of time that they wanted to. There was not a lot of science behind it. But the doctors and the nurses that worked in these environments found that the music was having an effect on these individuals, that it was helping with their stress, that it was helping with their mood. It would put them in a more positive mood, and it would actually decrease their anxiety and their pain. And so they wanted to find out why this was occurring. And that's how the discipline of music therapy formally began. So the first university to offer a music therapy, I'm probably gonna have to stand on this side. A music therapy program was actually Michigan State University, if anybody's from this area, Michigan State. It still has a music therapy program to this day, so you can still go to Michigan State and get a degree in music therapy. Since that time now, there's over 70 universities in the United States that offer a degree, a bachelor's degree in music therapy. And students who go to those universities, they study what music therapy is, how to implement music therapy, and some of the science behind music therapy, what you guys are going to be learning this evening. So like I said, I only have an hour with you, so I can't tell you everything that music therapists learn when they're in school, because then you all would be here for 4 years, and you would all have a music therapy degree when you leave. So you're kind of getting a crash course in what music therapy is. But you can get a Bachelor's of Science in music therapy. It's a 4-year degree, similar to other undergraduate degrees. You learn about music, you learn about music theory, music history, but then you also learn about psychology, anatomy and physiology, and then also the specific music therapy interventions to implement. There is a music therapy school here in St. Louis. It's at Maryville University, which is in Chesterfield, Missouri, not too terribly far away from here, about a 30-minute drive. And you can get your bachelor's degree in music therapy at Maryville University, and you can also get your master's in music therapy at Maryville University, so here in St. Louis. In Missouri, there's also other universities. UMKC in Kansas City offers a bachelor's degree, a master's degree, and a PhD in music therapy. And then also Drury University in Springfield, Missouri offers a bachelor's degree in music therapy. So you can go to a state school and get a music therapy degree, and you can also go to a private school and get a music therapy degree as well. So what do you have to do to become a music therapist? So to become a music therapist, you do have to go to one of these 70 accredited schools and obtain your bachelor's degree in music therapy. As a part of that educational process, you have to do a 1,000-hour internship with the population that you hope to work with. Doesn't mean that you have to work with that population, but it's something you want to get more extensive training on. And I know it's 7 o'clock at night on a Monday, so I'm not going to make anybody do math. But if you went to your internship site Monday through Friday, 9 to 5, you did 40 hours a week, it would take you 6 months to complete that 1,000-hour internship. So once you complete that internship, then you're eligible to sit for a board exam from the Certification Board for Music Therapists. And if you pass that board exam, then you get to become a credentialed music therapist. So if you ever meet a music therapist when you're out and about, if you're in a hospital or if you're in a nursing home or if you're in a school district and you see somebody walking around carrying a guitar, but they're not the music teacher, you can ask them if they're the music therapist for that facility. If they say yes, see if on their badge, if they have the credentials MT-BC. If they do, that means that they're board certified, that they've been through the entire educational process, and that they have a bachelor's degree, they've done their internship, and they've also passed their board exam. So you know that they're a highly trained individual in this discipline. Now here's the unfortunate thing for every music therapist or spouse of a music therapist in this room. Once you get that credentialed, board certified music therapist, it only lasts for 5 years. So during that 5-year period, the music therapist has to go back and get 100 continuing education credits to make sure that they are staying current with the field of music therapy, so that if you ever have a music therapist, you know that they are on the cutting edge, that they know exactly what's going on in their field, that they know what's going on in healthcare and school districts and any other setting that they're going to be working in, and that they're practicing the interventions that are the most current. So isn't that a good thing? So every year I have to get at least 20 continuing education credits, and every 5 years I have to reapply to make sure I can maintain my certification. So like I said, you can get a master's degree in music therapy, and you can also get a PhD in music therapy. And a lot of music therapists go on to get master's degrees and PhDs in other disciplines as well. So myself, I have a bachelor's degree in music therapy. I'm also have a master's in counseling. I'm a licensed professional counselor in the state of Missouri. And then I'm also getting another master's in health administration as well. And there's music therapists here in St. Louis that also have degrees as nurses and social workers, and there's even a music therapist that has their MD. So most music therapists that you'll come in contact with here in St. Louis are highly trained, highly skilled, highly educated individuals. So, like I said, here's your first resource. This is a really, really easy one to remember. And you don't have to remember it either because it's on the bottom of one of the handouts that you got coming in. So if this presentation piques your interest in any way into what music therapy is and you want to learn more about music therapy, all you have to do is go to musictherapy.org, and that will take you to the American Music Therapy Association website. That's the national association here in the United States for all music therapists, and you can read a lot more about what music therapy is, what music therapists do, where music therapists work in different parts of the country, research that's being done in the field of music therapy. And if you're really interested, it also provides you with information on music therapy conferences that you can go to. You do not have to be a music therapist to go to a music therapy conference. You can be any layperson to attend. Sometimes they even have them here in St. Louis. They'll have regional and national conferences here in St. Louis at Union Station and at different convention centers. So it's a really great opportunity that if you're in school and you're thinking about maybe you want to go on and be a music therapist, that you can go to one of those conferences and see music therapists and go to their presentations and learn more about it. So that's a really great resource. So musictherapy.org. So if you forget everything that I tell you this evening, remember that one website and you can read more about music therapy. So a lot of people ask me, what is music therapy? I've been working as a music therapist for over 14 years now. I started out at Barnes Jewish Hospital and then went to St. Louis University. So since 2004, I've been working as a full-time music therapist. When I first started, nobody really knew what music therapy was in St. Louis, and now it's becoming more and more popular, and there's more music therapists working in St. Louis, so I don't always have to explain what I do like I used to during my elevator presentations. So when I walk into elevator in the hospital and I'm carrying my guitar. It used to be nobody knew what I was doing. They're like, what are you doing here? And now some people will look at me and say like, oh, are you the music therapist for the hospital? I'm like, oh yes, I am. So I've seen a lot of change in 14 years. But a lot of people ask me when I'm on that elevator and I have to explain what music therapy is very quickly before they get to their floor or I get to my floor and they walk off. They say, well, what is music therapy? What do you actually do? And the best definition is utilizing music as a tool to achieve non-musical goals. Doesn't that sound fancy? The truth of it is, it's very simple. This is what music therapy is. Did anybody, when you were really young, ever learn the alphabet song? Learn to sing your ABCs? And did anybody teach that to their children or to their grandchildren? Why did you learn the alphabet song? Why did you learn to sing that song? Was there a purpose for learning to sing it? Yeah. So you can read? Yes, absolutely. You learned the alphabet song so that you can learn the alphabet so that you can learn how to read and write. That's perfect. So that song was more than just for entertainment value, right? I have a 3-year-old at home and he loves to sing the alphabet. It's entertaining for him, but he's also doing that for a purpose. The purpose of using that song was to learn how to read and write, was to remember your alphabet. And that's absolutely what music therapy is, when you use music to achieve something that has nothing to do with music whatsoever. So learning that alphabet song, that didn't have anything to do with music specifically, right? That was more for a language skill. But you use the music to help you achieve that goal. That's exactly what music therapy is. Make sense? So there's your definition, utilizing music as a tool to achieve non-musical goals. So when you think about music therapy and you're trying to explain what music therapy is to somebody else, just think of the alphabet song and use that example, and it makes perfect sense. Now, the interventions for music therapy become more complicated than the alphabet song, and that's why you have to go to school to learn what those interventions are. But the essence of what music therapy is really in that one simple definition. And then once people know what music therapy is, the next question they ask me is, so what type of music do you do? Everybody assumes that you have to listen to classical music to relax. You have to listen to Beethoven and Mozart, and that's not necessarily true. So when they ask me what type of music do you do, the answer is we do every type of music. So the type of music that you like the best is what's going to work for you during music therapy sessions. So one of the first questions we ask individuals is, what type of music do you like? And whatever type of music you like, that's the type of music that we're going to implement during our music therapy sessions. So that can literally be anything and everything. Country, R&B, oldies, big band music, music from the 1980s, contemporary music, Taylor Swift, Bruno Mars, anything and everything will work. And also any type of instrumentation will work as well. So many music therapists in the United States you'll see use the guitar and they sing, especially in healthcare situations in a hospital. I usually use the guitar because I'm going in and out of different rooms and I'm on the go a lot. So having a guitar is a very portable instrument. It'd be very difficult for me to push a grand piano down the hallway of a hospital. But that's why you see most music therapists using a guitar and they sing, but that doesn't mean that that's the only type of instrument that can be implemented during music therapy sessions. So any genre of music, any style of music, and any instrumentation of music, whether that's live or recorded, can be used during music therapy sessions. It's really what your preferences are, or what the group, if you're doing a music therapy group, what the group preferences are. So unfortunately it's not true. If you're a student in this room, listening to Mozart actually won't make you smarter, unfortunately. It's wonderful to listen to Mozart and it's wonderful to listen to classical music, but you do actually have to study as well. Just listening to that isn't going to up your IQ. But if Mozart isn't what you like to listen to relax, you don't have to listen to that. If it doesn't work for you, you don't have to use that. Whatever you really like is what is going to work for you. And in a little bit, we're going to tell you what actually does work for music if you're trying to relax or if you're trying to get more energized. It's not the style of music, it's something else. And we're going to talk about that in 1 minute. So this series, it's the science behind music therapy. So I will say everything that I'm sharing with you tonight is based on an evidence-based practice. So I'm not sharing anything with you tonight that's simply a theory or that's simply an idea or a best educated guess. Music therapy is an evidence-based practice. So that means that there's music therapists and there's other scientists here in the United States and all across the world who have dedicated their entire career to researching music therapy and researching and understanding how music affects our bodies and how music affects our brains. And so know that everything that I'm sharing with you tonight is an evidence-based practice. And if you want to learn more about current research that's going on in the field of music therapy, I really recommend that you go to one of these 2 journals. And they're professional, scientific, peer-reviewed journals. One of them is the Journal of Music Therapy, and the other one is Music Therapy Perspectives. The great thing is now that we're living in a day and age, when I first was in undergraduate school, Google didn't even exist, but now you can pretty much Google anything. Or, I don't know if anybody remembers going to the library here and you'd have to get out the fish, yes, thank you. And scroll through it and do the card catalog. Now, most of these journals are actually online. So you can get to them as an online resource. So you can actually use the library here as your gateway to learning more about what music therapy is. And so, like I said, going to one of these 2 journals is a great way to learn about all the research that's going on in the field of music therapy. They still print them in hard copies too, but I'm thinking that day may disappear as we go on. So, like I said, tonight specifically we're going to talk about music therapy and healthcare. So it's important to know that music therapy in healthcare is a really growing field. At one time, only 10% of music therapists actually worked in the healthcare industry. But now that number is growing more and more and more every year. So it's great to be on the cutting edge and to learn about music therapy in healthcare, so that if you come across a music therapist in a hospital like myself, you'll know exactly what we're doing. So music therapists in healthcare, we don't focus on just one specific thing. So we don't just focus on someone's physical being, or someone's emotional being, or somebody's spiritual being. We actually look at what's called the biopsychosocial model. And that's a really, really fancy term. So if you want to impress people, just say biopsychosocial model. Sounds really impressive, doesn't it? But it actually means looking at the whole individual. So the bio part of the word looks at biological factors. So those are physical characteristics, how our bodies function, the structure of our body. You know, when we get sick, if we have a virus, or how our genetics, play out, and what diseases we get throughout our entire lives. That's what we're talking about, our physical being, right? And then the psychological factors, those include things like our cognition, our emotions, our motivation. And then the social factors include things such as our family, our community, and our culture. And we found that all of those things, the biological, the psychological, and the social factors, all of those play into our health and well-being. It's not just one of those things. And that's why we started looking at more of a wellness model for people being well as opposed to people just being healthy. Because when you're thinking about being healthy, you're only looking at the biological factors. But if you're looking at wellness, you're looking at that entire holistic approach. And so music therapists really utilize their interventions to look at every single one of these factors, not just one of those factors in healthcare. So let's look at each one individually, and I'll give you some examples. And some of them are really, really exciting to watch. So the first one is our biological needs. So those can really differ depending on what an individual's diagnosis is in the hospital, if they have a cancer diagnosis, or if they've had a brain injury, or they've had a stroke. There's lots of different reasons as to why people are in the hospital. However, there are several common things that we focus in on for music therapy sessions. So one is improved functioning. So rehabilitation, music therapists can work with rehabilitation factors. And the second one, and this is where I've really kind of dedicated my entire career, is pain management, including physical tolerance and uncomfortable treatment procedures. So if you look at music therapists looking at biological things in the hospital and the healthcare industry, they're really looking at pain management, and then also there's music therapists that focus on rehabilitation. So let's look at some that focus on rehabilitation. And there's 3 here, but I really want to concentrate, since we don't have a lot of time tonight, but on this third one, which is called melodic intonation therapy. That's a specific music therapy intervention. And the reason I like to focus on it is because it's really interesting, it's really exciting. So melodic intonation therapy is a rehabilitative music therapy intervention. It focuses on our speech and our language. So before we had fancy brain imaging machines, before we had MRIs and PET scans and functional MRIs, we had a theory about where music was stored in the brain. And the theory was that music was only stored in one part of the brain, and it was stored in the same part of the brain that we process and produce language. And when you think about it, that theory kind of makes sense, right? Because music and language have a lot of overlap. So we have lyrics in music. We also have pitch changes in music as well. And we don't talk in monotone voices, right? So we have pitches when we're speaking. If I ask a question, the pitch goes up. If I make a statement, the pitch goes down. So the theory is that music and language were stored in the same part of the brain. And it's in one specific part of your brain. Who here is right-handed? And most people. Who is left-handed, like me? So if you're right-handed, language is stored in the left hemisphere of your brain, right in the middle, like right here. And it's in 2 areas. It's called the Broca's area and the Wernicke's area. And that's actually where you process language. So when I'm speaking to you, the sound goes into your ears, and then you process what I'm saying in this part of your brain. And then if you wanted to ask me a question later or answer a question that I ask, for you to produce language, it's stored in this part of the brain as well. Now, if you're left-handed, it's probably in the same exact area, but on the right hemisphere of your brain. So, no big deal, no big difference. Doesn't mean that you process language differently. It's just stored on a different hemisphere. But for the majority of people in this room, language is processed, stored, and produced in the left hemisphere of your brain in the Broca's and Wernicke's area. And for a long time, we thought that music was processed, stored, and produced in that same area. But then we became more advanced in healthcare, right? And we got PET scans and functional MRI scans. So now you can go into a machine and they can stimulate your brain. They can have you listen to things, or they can have you speak, or they can have you do things, and they can actually see what part of your brains light up. Has anybody seen those? You know, you see all those pretty colors when they scan the brain, and it's actually showing what part of the brain is stimulated and what part of the brain is active during different activities. And when they came out with that technology, they found something really, really interesting and phenomenal. They found out that music, yes, a part of it is stored in that language center of the brain. But in addition to that, music is stored and processed in every single hemisphere of the brain. And it's one of the only stimuli in the world that does that to your brain. Isn't that an amazing thing? That music is stored in your frontal lobe, in your occipital lobe, in your temporal lobe. And when you think about it, that actually makes sense, right? Who here has listened to a song and it evoked an emotion from you? It made you happy or it made you sad? Who here has listened to a piece of music and it reminded you of a particular time in your life? Older people, I think. During your youth, during your childhood, during your 20s, right? So, and that's not stored in the language center of your brain. That's stored in every other part of your brain. So isn't that an amazing thing? Now, the melodic intonation therapy actually takes that into account. And what happens is sometimes people have accidents. They'll be in a car accident or they'll have a stroke, and that language part of the brain will be damaged. And even though they can understand what people are saying to them, they can't speak. So you can understand everything somebody is saying to you, but you can't produce the words yourself. And it's a issue called aphasia. It's mainly called Broca's aphasia. And so it can be very, very frustrating. Could you imagine how frustrating it would be if you knew what everybody was saying around you and they asked you questions but you couldn't respond to them, and when you would try, nothing would come out? That'd be very frustrating. So individuals that have been in car accidents or had other traumatic brain injuries or have had strokes, sometimes that area of their brain is damaged where they can't speak when they once did. But they found that even though an individual can't speak, guess what they can still do? They can still sing. Isn't that an amazing thing? And it's because music is not solely stored in that language center of the brain. It's stored in every other hemisphere. So they found that these individuals with this particular type of aphasia, even though they couldn't speak anymore, they could still sing. They could sing every song they ever knew, and they could also start singing what they wanted as opposed to saying what they wanted. And that's what melodic intonation therapy is. It's when it's developed for people with aphasia that utilizes the patient's unimpaired ability to sing in order to facilitate spontaneous and voluntary speech through sung and chanted melodies. So what the music therapist does is that they'll actually work alongside with the speech pathologists in rehabilitation centers, and they'll help an individual learn how, say what they want through singing. And they sing and they sing and they sing and they get the rhythm down and they get the pitch down, and then slowly they take the music away. And that individual learns how to speak again because they've built new pathways in their brain. And usually what happens is if you're right-handed and language is stored in the left hemisphere of your brain, if that area is damaged, what you can do through melodic intonation therapy is rework those pathways so that you develop a new language center in the right hemisphere of your brain. Isn't that amazing? and you can do it through music, through melodic intonation therapy. Now this was actually used, we have your first example. If our gentleman that in the back wants to help me get this set up, YouTube example. This was actually used by a congresswoman not too many years ago, melodic intonation therapy. Does anybody who remember who Gabby Giffords was? She was the congresswoman who was unfortunately shot at point blank range. She was a congresswoman from Arizona. A couple other people unfortunately died, but she actually miraculously lived from being shot in the head. But because of that gunshot wound, that language center that we were speaking about earlier of her brain was damaged. And she was experiencing that aphasia I was talking about, where she can understand what other people were saying, but she couldn't speak herself. And so they actually used melodic intonation therapy and music therapy to help her regain her speech. And so this was a clip that we're going to watch, so you can actually see melodic intonation therapy in real life. It was featured on ABC prime time on a national news network, and it talks to you about what melodic intonation therapy is. So this is actually Gabby Giffords herself, and you're going to be able to see what melodic intonation therapy is. So go ahead.
Watch. Tell time with the
Welcome back to a special edition of Nightline, taking us deeper into the remarkable inspirational recovery of Congresswoman Gabby Giffords, Diane Sawyer, Bob Woodruff. We saw her struggle to find the words as she progresses. Something you went through.
Yeah.
Show Terry what you were showing.
No,
me.
this is okay. This is the book. This is a perfect example. Same thing I felt. They gave her a picture of motorcyclist, right? But the words that she said were medical and scary. And if you take all of the letters of medical and scary, they're basically letters that exist in the word motorcycle.
That's amazing.
And it's got the sounds of that, medical, cycle. It's got that in there. And same with the order of the letters. So she hears the sound and she's putting them, stacking them back into the word that she wants to say.
Wonderful image in the book that it's as if the words have been blown apart by a hurricane in your brain, and that you're trying to retrieve parts of them, and you get them, and they may not be in the right order, and you have another word that's inserted in the middle of them somehow.
This is what I say.
So
It's like your office is the glasses are shattered, the windows are shattered, and all the files in your cabinet fly out into the street. You go down and you get some of them, bring them back and put them in with work. Other than just blow in right through there and go right back into the cabinet, because the brain comes together over time.
Work. It takes willpower.
It does.
A miracle, as you say, and a struggle. And sometimes, in Bob's case, I'm sure, and as we'll see up next, in Gabby Giffords' case, the scientists, the doctors, learn from the patients.
Can you try and tell Mark? I love you.
1 month after the shooting, Gabby Giffords was in the hospital in Houston, settling in for the long haul.
You.
I can tell you that rebuilding speech after an injury to the left side of the brain is exhausting, often agonizing work. Before the shooting, she was a dynamic, engaging speaker.
The libertarians and the vegetarians, I want to thank you.
A Fulbright scholar, fluent in Spanish.
Good morning, everyone. Buenos dias.
Now, in those early therapy sessions in Houston,
You turn on the light.
it seemed as though words had abandoned her.
Let's try this one. Watch me. Yes. Turn on the.
For those of us injured on the left side of the brain, our loss of words can make us feel trapped inside our own minds.
Gabby, are you frustrated? Can I tell you something? It is going to get better. Okay? It's frustrating right now, but it is going to get better. You've come a long way in 5 weeks. You've come a long way.
And then, in this emotionally charged moment, to our absolute amazement, we heard this.
Okay? You're going to do this. You ready? This little light of mine, I'm going to let it shine.
Remember, at this point, she couldn't say the word light. Suddenly, there she was, singing that word and a whole lot more.
I'm gonna let it shine, let it shine, let it shine, let it shine. Excellent. Well, good morning. Gabby, how do you do?
Megan Morrow is Gabby's music therapist.
Why is it that someone who can't speak can sing?
Because music is accessed in many different areas of the brain that aren't designated for language.
Let me hear ya.
We're retrieving pitch, melody, rhythm through all these different areas, and those are working to get your language back.
Remember we told you that language is normally held in the left hemisphere of the brain. Music exists in both hemispheres. Incredibly, scientists are finding that music therapy has the potential to rebuild language on the uninjured right side.
Nothing activates the brain so extensively as music, and it's really only been in the last 5 years that brain imagery which showed it had been possible to create a new language area in the right hemisphere, and that blew my mind. One would have said that's a fantasy.
Reminds me of being stuck in traffic on the freeway. You aren't able to go forward on that pathway anymore, but you can exit and go around and get to where you need to go.
In therapy, phrases are combined with music.
I am fine. I am fine.
Then gradually, the music fades away, and the words can stand on their own.
So what are you gonna tell him? Yes. Give me a kiss. Right now. Kiss.
That's good. Thank you. So isn't that a miraculous thing? You can actually see melodic intonation therapy. That's on YouTube too. They have even longer stories about melodic intonation therapy that you can go on YouTube. If you just type that in, it'll pop up that entire piece for you. It's about a 15-minute long piece if you want to watch the entire thing. But that just gives you a brief example in the time that we have together this evening about what melodic intonation therapy is. Any reactions to that? What did anybody think? Was anybody surprised? Yeah.
I worked as a speech pathologist.
Yeah.
I'm very familiar with some of this, and it's they use that also for stuttering as well.
Yes, absolutely.
To help with, with the pitch and everything, and just being able to make that become more an automatic
Yeah.
thing versus thinking about it so much.
Yeah. And it's an amazing thing to see in real life, isn't it? It's
just
amazing.
How,
Yeah.
in rehab and stuff like that, a lot of these disciplines cross over.
Mm-hmm.
Music therapy, you've got PT and speech,
Yeah.
all that kind of using different modalities, but working on the same sort of
Yeah,
goals.
and that brings up an amazing point, that music therapy is really perceived and looked at as a complementary therapy as opposed to an alternative therapy. And there's a difference between complementary therapies and alternative therapies. Complementary therapies mean that music therapists want to work with other disciplines, like speech pathologists and physical therapists and occupational therapists and nursing and physicians, that we're not there to replace conventional forms of treatment. So nothing that I'm sharing with you tonight says that, oh, instead of doing speech therapy, you should only do music therapy. Or instead of, I work at a cancer center, I would never say instead of getting your chemotherapy treatment, you should get music therapy to cure your cancer. That's the difference. A complementary therapy is saying we want to work with other disciplines. We want you to still engage in conventional forms of treatment in healthcare. But in addition to that, you can utilize music therapy to complement, to enhance, and to improve those other therapies to work together. An alternative therapy is saying instead of doing speech pathology or instead of doing physical therapy, you should do music therapy. And that's not what music therapists condone, and that's not what music therapists promote. They really, in healthcare, want to look at being complementary therapists. So you saw the music therapist was there working with the speech pathologist. That's when music therapy has the most benefit, is when you pair it with those conventional forms of treatment to enhance those and to make them work better and to give you more of an opportunity to practice those things in rehabilitation. So that brings up an excellent point. Thank you. So that's one side. So music therapy can be looked at in a rehabilitation modality, But in healthcare can also be looked at, when we're looking at physical things, to look at pain and anxiety. And that's really what I focus in on as a music therapist. And sometimes individuals, when they're in the hospital, obviously have had surgery or they're getting some type of treatment that causes them to experience physical pain, right? My mom just had knee replacement surgery, so I'm going through that right now with her, that she's experiencing the physical pain of having knee replacement surgery. So music therapists can also look at that in the healthcare modality. So we can look at things such as anxiety, tension and fear, and perceived loss of control can accompany and exacerbate feelings of distress and pain. So what does it feel like when you're anxious or you're not feeling well or you're hurting somewhere? Is your heart rate really fast or is it really slow if you're anxious? Anybody ever? Yeah, your heart rate goes up, right? What happens to your blood pressure? Does it go up, stay the same, go down? Yeah, blood pressure goes through the roof. Does anybody get a lot of muscle tension when they're feeling anxious or stressed out? Yeah. My shoulders always go up. I don't know if anybody else has that experience. Like you don't realize like your shoulders are about ready to touch your ears. You know, does anybody make fists with their hands? How does your breathing? Do you start breathing really shallow if you're anxious or you're stressed out? And that's what the second handout I have for you tonight. This really focuses in on stress management and anxiety management and pain management for music therapy, because you guys really pointed out a lot of those things. When you're anxious or you're stressed or you're experiencing physical pain, your heart rate increases, your blood pressure goes up, your breathing increases, you breathe more shallowly, you have a lot of muscle tension. And because of that, pain medication that you receive in the hospital actually doesn't take effect as quickly, because the veins in your body are actually closed a little bit more when you're under stress. Does anybody get really cold too, or get really hot when you're under stress? Like I start sweating, and my hands are cold and clammy, and my feet feel wobbly. So those are all physical reactions to being under pain or under stress or anxiety. And so for music therapy, we can actually use specific interventions to help with those things. So like I said, any style of music works for music therapy. Remember me saying that at the beginning? Any style of music works. Any style of instrumentation works. And you could see with the Gabby Gifford clip, she was doing This Little Light of Mine and a Cyndi Lauper song and a Tom Petty song. So it wasn't just all about listening to classical music. The reason that they used that type of music for her sessions is because that's the style of music that she liked. And what we found is that it's really not the style of music, but it's the speed of the music. So how fast or slow the music is that influences somebody's anxiety perception, stress perception, and pain perception. Isn't that an amazing thing? That's why style doesn't matter. It's the speed of the music. And here's another really great word. In addition to the biopsychosocial model, here's another really impressive word you can impress your friends with. It's called entrainment. And entrainment is where we like to match the speeds of the rhythms that we hear around us. As human beings, we're unique from every other species on the face of this earth when it comes to the speed of music. Do you know that we're the only species on the earth that can synchronize with rhythms that we see and hear and feel around us? Isn't that an amazing thing? No, so you can't go home tonight if you have a dog at your house or your cat. You can't get them to bark in time with music. You can't get them to meow in time with music. But you as a human being, you can clap in time with music. You can move your feet. You can sway back and forth, right? You can bob your head. We're the only species on this earth that can actually do that can synchronize with rhythm. It's an amazing thing. And music therapists use that to help people be more relaxed and experience less pain and less anxiety when they're in the hospital. And it's through a process called entrainment. So entrainment is where we actually match the speed of the music to somebody's heart rate, and then we gradually slow it down over the course of the music therapy session. Because when your heart rate is slower, you're more relaxed, your pulse is more regular, your blood pressure decreases, your breathing becomes deeper, and the pain medication you're actually receiving will take effect a little bit more quickly because your veins are more open when you're relaxed. So you can see how music is used to complement conventional forms of treatment. Isn't that an amazing thing? And that's why music therapists usually like to use live music, like the piano or the guitar or vocals while they're doing a music therapy session, because then they can change the speed of that music, right? So when you have recorded music, the only thing you can do is press play and then it's off and it's going. You can't adjust the speed to somebody's specific heart rate and then induce this relaxation response. It's only whatever the music is playing when you press the play button. But recorded music works really, really well if you're on your own, though, as well. So if you don't feel like you're an accomplished musician, or you can't have a music therapist following around you to every single staff meeting that you know is going to stress you out, or every big exam that you might have at school or a homework assignment, you can't have a guitarist walking behind you going, just come with me and help me. You can use recorded music. But it works best when it's live music and the person is specifically doing it to your resting heart rate. So, and resting heart rate is anywhere between 60 and 72 beats per minute. Some people are a little bit higher, about 80 beats per minute. And so once you've been trained to that music, you like to match the speed of that music. So your heart rate starts in training, your breathing starts in training, and your pulse starts in training to that music. Isn't that an amazing thing? And it's not just for pain management, but it can be used for stress as well. So who in this room has ever experienced any type of stress ever in your entire life? Anybody? Okay. That's another common thing about being a human being, is sometime in your life you'll experience stress. So this is your takeaway for the evening, that you can actually take this home with you, this knowledge, and use this for your own stress management in your own life, whether that's you have a big test coming up at school, or you have a big project at school, or you have something important going on at work, or something important going on in your personal life. You can use music to help you relax. And it doesn't take a lot of time either. Usually music therapy sessions are anywhere between 30 and 45 minutes long, but you can have this experience from just 1 to 2 minutes, even 5 minutes. So a lot of people say like, oh, I don't have time to go to an entire yoga thing or do Pilates or go to this exercise group or meditate for an hour. This is an intervention that you can use for just a couple of minutes a day to help with your stress management. Would you guys like to try it this evening? Okay. Yeah, I brought my guitar with me. All you have to do, this is all you have to do to this intervention. Sit in your chair. Okay? You don't have to get up and participate. We don't all have to form a circle or anything like that. All you have to do is sit in your chair and listen. Sound good? So this will be your audience participation for the night. It's a very simple thing. So, music therapists work with individuals, so people one-on-one, and they also can work in group sessions for large groups. So you guys can be my group this evening. And I brought my guitar with me. Now when we're working in groups, music therapists try to choose a style of music that will please the masses, right? So when you're doing an individual music therapy session, I can ask each person, what kind of music do you like? What's your favorite song? But when we're doing a group, we have to kind of try to see what's going to be the best thing to please everybody. So I'm going to do a very generic song. If it's not your taste, I apologize, but we're trying to please the dynamics of this group. And it's a great dynamic group. We have lots of different backgrounds, lots of different age ranges. So we'll pick something that hopefully will please as many people in this room as we possibly can, okay? But if this isn't your cup of tea, if this doesn't work for you, know that you can take this concept home with you and do it with the style of music that you enjoy, all right? So all you have to do is sit back and relax. Some people, when they're doing this intervention, they like to close their eyes. Some people don't. I'm the type of person that I don't like closing my eyes when I'm trying to relax. So if you don't like to close your eyes, that's perfectly fine. If you do, that's perfectly fine as well. So close your eyes if you want to. If you don't want to close your eyes, I always tell people, find something in the room that you can look at and focus your gaze on. So, so you're not like looking all over the place. Just pick one thing in the room that you can kind of look at so that you can just focus your attention on the music and not, what's this person walking by or that person coming in and out of the door. So if you want to keep your eyes open, just find one thing in the room. I try to tell people, don't worry about what you're thinking about. I don't know if anybody in this room has ever tried to meditate before. and you get quiet for 5 seconds, and then you're like, oh my gosh, I gotta get milk at the grocery store. Remember that, milk, 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 milk. Oh, and I have to sign my child's permission slip for school, so don't forget about that. And the more you try to push those thoughts away, the more they come. Has anybody ever had that where you're like, just quiet your mind? But the more you try to quiet the mind, the more active your mind gets. So I tell people, don't worry about that. If you start having thoughts, that's perfectly fine. I tell people, just think about your thoughts as if they're billboards on the highway. So you're driving down the highway, you see a billboard, right? You read it, you look at it, you take it in, and then it passes you by. And you see another billboard, you read it, you look at it, you take it in, and then it passes you by. So think about, if you're having a lot of thoughts, think about that. If it's just a billboard on the highway, I'm going to think about it for a moment, I'm going to take it in, and I'm just going to let it pass me by. Sound good? Okay. So that's all you have to do. And leave the rest to me. I will do the music for you. And don't worry about your breathing. You know, don't worry about, do I have to breathe in through my nose and out through my mouth? And am I breathing too shallow? Am I breathing too heavy? Am I breathing too loud? Don't worry about that. Just breathe normal, okay? Just breathe normal. Don't worry about your breathing. And then just listen to the music and enjoy. Edelweiss, every morning you greet me, small and white, clean and bright, you look happy to meet me. Blossoms of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever. Edelweiss, every morning you greet me, small and white, clean and bright, you look happy to meet me. Blossoms of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever. Blossoms of snow, may you bloom and grow, bloom and grow forever. Edelweiss, Edelweiss, bless my homeland forever. So how do you feel? Better. Does anybody feel a little bit more relaxed? Yeah. So if you notice, the music actually started pretty quickly, and then over the course of it, I slowed it down very slowly. You know, I saw a few people in the room who actually began breathing in time with the music. It's an amazing thing. And that song was only about 2.5 minutes long. So just think about how much better you feel after just 2.5 minutes of doing that. What if you did 5 minutes? Or what if you could actually work in 10 minutes? Wouldn't that be an amazing thing? And that's the music therapy and intervention known as entrainment. And in the hospital, we use that when people are anxious or afraid or experiencing pain. And we can actually gear the music specifically to what they like and do live music and help them become more calm and relaxed. Sound good? Yeah. So that's your other, yeah.
Do all music therapists have to play an instrument?
So yes, that is a very good question. Yes, all music therapists do have to play an instrument. So part of that academic curriculum that I was talking about at the beginning of getting that bachelor's degree, music therapists do have to audition to get into the school. So they all have a primary instrument that they play, and that can be any instrument. And then in addition to that, you have to take piano and guitar while you're in school, and vocal techniques. And then to graduate, you have to pass a piano proficiency and a guitar proficiency as well. So on some level, all music therapists know how to play the guitar, all music therapists know how to play the piano, and then music therapists also have a primary instrument in addition to that. So yeah, that's a really good question. Yeah. Yeah. Yeah, did you have a question?
No,
Oh, okay. Yeah. Anybody else? Okay. Yeah.
That 1,000 hours that you had, like for the practicum, is that done at the end or
Mhm.
after?
So that's done at the very end. So it's technically a 3 credit hour course that you sign up for, even though you're not at the university, but it's still, they have to prove that you did this internship. So it's, it's a class technically.
It's like the last semester before you're before you're actually
Yeah, and
just a full-time practicum.
it's a full-time practicum, and it actually stretches over 6 months. So it's like almost like 2 semesters. People either start it usually in January, or if they graduate in the spring, they'll start it in June or July and go to the end of the calendar year.
Is the program more than 4 years? Is it 4 years?
It ends up being about, yeah.
In that practicum afterwards?
Yeah, so it ends up being about 4.5 when it's all said and done. It's very similar though to other healthcare professions or academic professions. So if you become a teacher, you have to do a student teaching hour. If you become a counselor, you have to do so many hours of internship, supervised. Social work's the same way. Don't even get me started on what doctors have to do. So it's very similar to a process that other disciplines in healthcare have. I'm sure speech pathology has practicum or internship. They call it different, they title it different things, but it's the same thing.
It's so similar to
Yeah.
the process of being
Yeah.
certified as a speech pathologist.
Yeah. And students can do those anywhere in the United States. So there's something called the National Roster Internship for Music Therapy. And so a student can do one in the local area where they went to that university, or they can go anywhere in the United States they want to that has a program. So I got my degree at Maryville University, but I did my internship in West Palm Beach, Florida, at Hospice of Palm Beach County down there. So a student isn't bound to having to go to an internship site that's affiliated by their university. They can actually just apply at any one of the national roster sites. And if they're accepted, then that's where they can go. Some of them offer free housing, some of them offer stipends, some of them offer meal plans, so things to help with the expenses if you're doing this internship full time. But yeah, that's a good question. Yeah.
So you said that like sometimes you can use music to like give you more energy, not just
Yeah.
to relax.
Yeah.
So like
How does that work? So that's a very good question. I was actually just going to talk about that. You beat me to the punch. But you can actually use entrainment in the opposite way. So we used it here to help us relax. So we slowed the music down. You can actually use entrainment to help you become more energized. So does anybody here listen to music while you're exercising, when you're running, or yeah, that's the entrainment process as well. So you can actually speed the music up, and it gets your heart rate up, it gets you more motivated, you synchronize with that rhythm, you start running in time or working out in time. For anybody here that ever did the Jane Fonda in the 80s, that's a perfect process of entrainment. You know how she did those aerobic videos to the music? They were all set in time with the music. That's entrainment as well. So that's a perfect example. So you can use it to help you relax, but you can also do it to help you become more energized and to become more active. And some music therapists do that, especially in nursing homes and extended care facilities with individuals that need to have some type of rehab or some type of orientation and becoming more connected with their peer group, they can use music to help them become more energized. So I used it to help you guys relax this evening. You can also use it to help you get more motivated. Yeah, works both ways. Yeah.
What is the job prospect? Is this a growing field where there's a lot of jobs, or is it?
Yes.
You know what I'm asking? Are there a lot
Yeah.
of jobs out there? And
Yeah.
Is it a flooded field where we're having a lot of people go into it and there aren't as many jobs?
So this is my opinion, so you might have another music therapist give you another answer. So take this for like as one music therapist and one opinion. So the reason that I started out in school as a music education major and transferred to Maryville University and became a music therapist instead. The reason being, at that time, that was in the 2000s, early 2000s, I did research and found out that as the number of music education jobs was going to decline, unfortunately, the number of music therapy jobs was going to increase. And they're continuing to increase. And it's for many reasons. The first one, this gets very technical, so this one's for the adults in the audience. In healthcare, we're getting away from fee-for-service purchasing. So with Medicare, Medicaid, and private insurance, how you used to pay for your healthcare is you broke your leg, you go in, you need a cast, they charge you for that. The doctor's visit, they charge you for that. If you needed some ibuprofen while you were there, they bill you for that. It was called fee for service. Everything you did in the hospital, there was a line item that they billed you for. We're getting away from that in healthcare because it's an unsustainable model. That's why healthcare is getting more and more and more and more expensive. So now we're going to this really fancy term, it's called value-based purchasing, where services are going to be bundled, so you get one flat fee. And then Medicare is actually doing this now in acute care hospitals. This is happening today. They get a fee, but then in addition to that, if they meet other benchmarks, they get more money. They get fully reimbursed for that patient being in the hospital. And value-based, it's basically what it says, how valuable the health care was. And one of those things that they really focus in on is quality of care and patient satisfaction. And as quality of care and patient satisfaction is becoming more instrumental in healthcare, and it's becoming more important to hospitals because they want to get as much reimbursement as they possibly can from Medicare and private insurance, music therapy and other complementary therapies like art therapy and pastoral care and activities therapy and recreational therapy is becoming more and more important because the hospitals need patients to have high satisfaction and also have high quality care, right? And that's all kind of what we want as well, you know. When we go to a restaurant, we want the best food we can get. When we go to the hospital, we want to get the best possible care that we can get. So it's called value-based purchasing. It's a keyword. If you can Google that and read all about value-based purchasing in Medicare. Hospitals take it very seriously right now. But here's the caveat. Can you get a job as a music therapist? Absolutely. May you have to potentially move out of St. Louis? Yes. So, you know, if you want to stay in St. Louis and be a music therapist, you can absolutely do that. But when you go to school, you're going to have to be the bright, shining star in the program. You know, and you can be a big fish in a small pond type of a situation. So if you want to get a job as a music therapist, you can absolutely do that. You might have to move out of St. Louis to get that position. Where
Because the schools here and it's just set, you know, there's just so many here and they aren't throughout the country.
No, Missouri really isn't saturated. There's some cities that have more than one music therapy program at different universities. So St. Louis really isn't very saturated at all. The great thing is St. Louis has a really strong music therapy community as well. And so other cities in different parts of the country, the music therapists aren't as strong of a network. So, you know, I know every music therapist in this room, her right there. Natalie's husband is a music therapist. We all know each other. So that's one great thing about St. Louis is it's a really, really strong music therapy community, which can help with your job prospects. But other cities have great music therapists as well. and have wonderful universities in music therapy as well. So the best way to find out is just go to that musictherapy.org. It has a list of every single university that has an accredited program and how to apply at that program and who to contact, and do you want to go to a state school? Do you want to go to a private school? Do you want to go to a large school? Do you want to go to a smaller school? All those things as well. Is there a certain part of the country you want to live in? You can go to that musictherapy.org and get all the schools and kind of start sifting through them. So, yeah, that's a really good question. But yeah, so can you get a job as a music therapist? Absolutely. May you have to move out of St. Louis? Yes. And that might not be what everybody tells you, but yeah, you might have to leave St. Louis. So. Yeah.
So do Medicare, Medicaid, and other insurances work well with music therapists, or is it through the hospitals?
So it's through the hospital. So right now, music therapy is not covered under private insurance or Medicare and Medicaid, except in very specific instances for that rehabilitation. So music therapists that work in rehab, it might be covered, but if not, but that doesn't mean that you can't be a music therapist, and that doesn't mean you can't get music therapy services if you're in a hospital. So if a music therapist comes and offers music therapy services, if you're a patient in the hospital, if you have a loved one in the hospital, and a music therapist comes and offers that service and they say they work for the hospital, you're not going to pay for that music therapy session. Okay? So even though it might not be covered under insurance, or it might not be covered under your particular insurance, the hospital is consuming the cost of that music therapist's salary. So I always tell people, if you ever get visited by a music therapist, or you have a loved one in the hospital that gets visited by a music therapist, and they offer the service to you, take them up on it, give it a try, because it's very non-invasive, there's very minimal side effects that you experience when listening to music, and you're not going to pay for it. So even if it's not covered under your insurance, the hospital is paying that music therapist's salary. So you're not going to get a bill for that music therapy session. But that's a really, really good question. I get that question all the time, every single day. Yeah.
So the idea of private practice as a music therapist.
Mm-hmm. You can do that, absolutely. Mm-hmm. So if you have a music therapist, then there are some great private practice music therapists here in St. Louis that have very thriving private practice companies. If you do have music therapy through private practice, your clients that you get will be paying you directly. So if you get it at a healthcare institution, or you get it through a school district, or you get it through a nursing home or something like that, then you're not going to have to pay for it. But if you actually hire the music therapist to come to your home, or you go to their office, then you'll get the bill from that music therapist. So, and a typical music therapy session is like $40, $50 an hour. Here in St. Louis. It'll be different if you live in California or New York, but $40, $50 here in St. Louis, yeah.
Is there any way for students who might be interested in this profession to come and observe someone working?
Yeah.
Just to get more of a feel for what it's like?
Yeah, oh, absolutely. Absolutely. So the best way to do that is going through the university here in St. Louis. If you go to Maryville University, if you go to maryville.edu and type in music therapy, it'll pop up with their page and who to contact directly, and just say, I'm a student and I'm thinking about getting into this field, and I just wanted to see if there was some music therapists in St. Louis I could go out and observe with, and they'll connect you with those individuals, and you can kind of go and observe and just watch and see if it's something that you find interesting. So yeah, that's absolutely, that can absolutely happen. Yeah, maryville.edu. Yeah. Yeah.
Are there any universities that are doing dual programs,
Mm-hmm.
like an MSW music therapy or a PhD psychology with music therapy?
There's not a ton, but in Iowa, there's a school called Wartburg University, and this is an interesting thing. To be a music therapy student at that university, you're also getting a degree in music education. So they get 2 bachelor's degrees when they're done. They get a music education degree and a music therapy degree. So that's one example, is to be in that program, you're a dual major. And that can be really beneficial. That opens you up to a lot more job opportunities to go work in education, or then also to go work as a music therapist anywhere, but then especially in an education system. In the master's degree programs, there's a lot of dual going on. So you can get, like at Maryville, you can get a master's in rehabilitation counseling and become a licensed professional counselor, which really helps if you want to have a private practice, because then you can bill with your LPC, and then you can also get a specialization in music therapy. So there's a lot of opportunities there for that. So if you're thinking about having a private practice and billing, get a social work degree or become a licensed professional counselor, and then you can get the music therapy and bill for those music therapy sessions as a licensed professional counselor. Yeah, and I will give you my card if you want to get some follow-up information about specifically how that works. Yeah, that's a good question. So to cover a couple more things, so that's the entrainment. So we're also going to look at psychological and social needs. So one thing that we do in music therapy is a really fancy term called normalization. So we're actually helping the hospital environment become more normal and acclimated. Who here hangs out at a hospital every single day? Anybody here besides me? You know, just loves being in a hospital. It's like being in their living room. I could kick back and just, look at my Facebook page and hear alarms going off and totally not be fazed by it. Who here goes into a hospital and you hear things that you don't understand? Has anybody heard like code blue? And you're like, I don't even know what that means. Or you hear machines going off. Who here has ever gone into a hospital and gotten lost before? Couldn't figure out where the door was. Yeah, that happens, right? And so it's interesting. Individuals that work in healthcare, we get so comfortable being in that environment, we forget that it's not an environment that everybody is comfortable being in, that everybody doesn't go into every single day. So hospitals are trying to become more and more aware of that concept and making the environment more normal and more pleasant for individuals to be in. And one way that we can do that is through music, because we might not understand the sounds that are coming out of machines or things that we hear on intercoms, and we might get lost in the building. But when we see music and we hear music and we see a musician, we understand what that means, right? Because every single person in this room has heard music before in your life, correct? So that's something that our patients can see and be like, I know what that is. I feel like I understand what's going on. This is one thing that I understand, is the music therapy sessions. And so as music therapists, we're really aware of that in the healthcare model. Because a lot of times we understand, I work with individuals who are diagnosed with cancer. Many of them have to take medications at very specific times for their treatment process to work. A lot of them can't leave the hospital for long periods of time because they don't have an immune system. So they have to be in the hospital for 2 weeks, 4 weeks, 5 weeks, 3 months, 6 months sometimes. They might have dietary restrictions. Do you know if you have a suppressed immune system because you're getting chemotherapy, you can't go to Dairy Queen? You know that? That's an interesting thing, because Dairy Queen has soft serve ice cream and there's so much bacteria in those machines that they would potentially become seriously ill from eating at Dairy Queen. Huh? Yeah. And so and so we can fight that off really easily, but if you don't have an immune system, you could get really sick from doing that. So could you imagine, like, you had all these freedoms and then all of a sudden there's so many restrictions. Most people who are getting chemotherapy treatments couldn't come tonight to this presentation because there's too many people in the room and you guys have too many germs and you might get them sick. So think about all the places you can't go to and all the things that you can't do. But music therapy is something that you can do that can help you connect with the outside world. And unlike other disciplines, with music therapy, you can help dictate what's going to happen more in the session. So with music therapy, we say, what time of day do you want us to come and see you? How often do you want us to come and see you? How long do you want us to be there? What do you want to talk about during your music therapy sessions? What do you not want to talk about? What type of music do you want to listen to? Do you want to focus on getting energized? Do you want to focus on getting relaxed? Do you want to listen to music from your childhood, or do you want to listen to contemporary music? Do you want to talk about what's going on with your treatment, or do you want to talk about your family, or do you not want to talk at all? Do you just want to listen to the music? So when you have a lot of opportunities for choice and control, that actually helps lift people's mood. It decreases stress. It helps individuals have a more positive outlook on their treatment process. And music therapy can be very beneficial for those things and to help with those things. So that's a process called normalization. So incorporating objects and people and stimulation like music into the hospital environment to make it more quote unquote normal and comforting and something that we can all enjoy. Can you imagine? I tell people, some people when they're in the hospital, I said all you had to do was get sick and get into the hospital to get your own personal private musician to follow you around all day. Amazing. Isn't that an amazing thing? So we only have a couple minutes left. But with that time, just to look at, in addition to the normalization, we want to look at other psychological and social factors. So music therapy can be used to promote recovery and lifestyle changes, and it can also be used to help us explore and express our moods. Has anybody here, like I said, listened to a song and it took you back to a specific time in your life? Or it made you have a specific emotion, right? Whether that was happiness or sadness or frustration. So for some individuals, when they're sick or they're in the hospital or they have a disease or a disorder, sometimes it can be very difficult to express what they're thinking and feeling and to express their emotions. And music has a great way of tapping into that. Because like I said, music is stored in every part of the brain, even the part of your brain that produces emotions and processes emotions. So music therapy can be very beneficial to help people express their emotions appropriately and in a safe place during that music therapy session with people that they love. So a lot of times during music therapy sessions, we'll encourage the patient to have their family members there, to have their spouse, to have their children, to have their parents, so that it can be an opportunity to promote wellness, but then an opportunity for that individual to express their emotions and what they're thinking and feeling during their treatment process. And finally, like I said, music therapy is an evidence-based practice. So we're looking for things that we can specifically measure during music therapy sessions to know whether or not we're having an effect. And those are broken down into 3 different categories. So the first one is self-report measures. What is the patient telling us? Is it working for them? You know, do they feel more relaxed? Do they feel more anxious? Do they feel more energized at the end of the music therapy session? And then we're also looking at observational things. What can the music therapist observe? Did the individual's breathing slow down? Did they close their eyes? Did their muscles relax? Did they actively participate during the session? And then we're also looking at clinical measures, which is looking at individuals' blood pressure, their pulse, how many times they breathe in a minute. I did a research study not too long ago at the St. Louis University Cancer Center, where we had individuals that were getting chemotherapy treatments. We had a group that would get a specific music therapy intervention for 30 minutes, and we took their blood pressure and their pulse and their respirations per minute at the beginning of the session and then took them again at the end of the session, and we saw a significant decline in their blood pressure and their pulse and their respirations per minute due to the music therapy session. So we are looking at measuring those effects of music therapy in a clinical manner. So it's not just, I'm the music therapist, I think music therapy is great and it works for everybody. You know, that's why I said, that's why this music therapy is a part of this series this evening, because it is an evidence-based practice. And it's really fun to get to read some of those journals and see all the ways that music therapy is being used, not just in healthcare, but in schools, for people with mental disorders, for people with Alzheimer's and dementia. So, and then for also wellness. So for everybody in this room, you can use music therapy as well on a daily basis to help with your health and your well-being. So you don't just have to, quote unquote, have a problem or have an issue. You can use it in your daily life to help with your own stress management, to help you express your emotions, to help you connect with other people. Because one of the best things is getting to experience music with other individuals and to have a connection with them about it. So I want to thank you guys so very much for letting me present to you today. Is there any other follow-up questions? Yeah.
I was wondering, like, speech can also, like, you know, trigger or like cause emotions too. So would that be in different parts of the brain too? Like it can bring back memories.
It can, it absolutely can. But where it's produced, like when you're talking to me right now, where that is in one specific part of your brain.
Okay.
And they found that in music, where you produce music is not just in one specific part of your brain. So that's the difference. Yeah, so that's a really, really good question. Yeah. Yeah.
I've noticed that EMDR isn't effective without sound. Is
Yeah.
that really just mostly entrainment?
Yeah.
And
Well,
relaxation is coming from the rhythmic.
the rhythm. It's the rhythm. It's the speed of the music. So I have done entrainment with individuals with hearing impairment as well, and you have them place their hand on the guitar. Yeah, it's the vibrations. So it really doesn't have to do with the style of music, but it really is the speed of that music.
That always was my theory.
Yeah, yeah.
Generally, even if a person has cataracts or something, they can't
Yes.
see the lights. When they
Right.
walk and hear their footsteps,
Mhm.
or they hear the ticking.
Yes. Yeah. So you just use a metronome. Yeah. It's entrainment. It's all entrainment. Yeah.
About a $10,000 piece of equipment buying their license.
Exactly.
Because it's like a metronome.
It is. It is. And it's a metronome. And you can get yeah. And the great thing is you can get a metronome now on your smartphone.
Right.
Where we used to have to buy these big
Oh, they were expensive.
zip. Yeah. It's a free app you can get on your smartphone. And it's the same thing. It's the same thing. Yeah, yeah, absolutely. Same concept. Yeah.
You have a wonderful.
Oh, thank you. Thank you. My mother would thank you for that. I got it from her. So, any other questions? Yeah.
You were talking about normalization.
Yeah.
I had an opportunity to be at EJC
Yes.
a couple months ago.
Yes.
And they had someone in the lobby playing a cello.
Yes.
So I was wondering, was that maybe a music therapist or somebody they just brought?
It could have been. It could have been a music therapist, or it could have been a volunteer. So through my music therapy program, I do have volunteer musicians come in, and it's from two great sources. So first, we have a partnership with the St. Louis Symphony, that we actually have symphony musicians come into our cancer center once a month and perform for patients while they're getting their chemotherapy treatments. And then we also have medical students from St. Louis University who are musicians who want to keep playing their instrument while they're in medical school. They'll come in and volunteer at our cancer center. So it could have been a music therapist, or it could have been a volunteer that volunteers for the music therapy program. But yeah, that's a wonderful thing, isn't it? You see it and you're like, oh, okay, I get one thing that's going on. I understand one thing that's going on here. Yeah.
Can music therapists help with fine motor skills, like if there's
Yes.
brain injury with that?
Absolutely. So like I said, we just scratched the surface today, but there are music therapists that work in rehab that help with gross motor skills and fine motor skills. So with walking, and then for all of those small things as well, there's specific music therapy interventions that assist with that. Yeah. Yeah, yeah, absolutely. Well, thank you guys so much. I'm so happy you came this evening. Enjoy your night and the nice weather we have. And I hope to see you guys all again sometime. So, thank you.